BusyBox's expert information on chemical peels. What are chemical peels?
A chemical peel is a treatment for what you're doing is you're trying to make an improvement on the quality of the skin by applying an acid. Okay, the acid usually can be, I don't know, alpha hydroxy acids or AHAs. That's a very common one. Usually they're derived from sugarcane. They are natural ones. Those they tend to be, rather low strength, although they can be a higher strength. And then there is the very much, much more strong in concentration, like trichloroacetic acid or TCA. The TCA are the ones that they are only performed by a physician, and usually you tend to do it in the theater because obviously they are much more aggressive. You can see, obviously, as well, more dramatic results.
What are they designed to treat?
The usual thing is that you're trying to treat certain slight imperfections in the skin. For example, certain uneven pigmentation, lentigos, dyschromias, these kind of things, meaning that the person has uneven color and they want to even out the color. That's one way. Another way would be, for example, a person that has very big pores and they want to reduce the size of the pores, or they want to simply improve the quality of the skin, the elasticity. They want to improve they want to create a more supple kind of skin. That usually tends to be the ideal candidates.
What happens when it is applied?
The first thing you will require is probably to sedate or to put the person to sleep. Then what you're doing is it's like if you're painting, with a brush. You're painting the face, usually your face, your neck, or the décolleté, whichever areas you want to treat, even the hands. You're painting that person with that trichloroacetic acid, for example. Then what you're doing is you're applying an acid that what it does in contact with the skin is coagulates the top layers of the skin. Coagulates or destroys, if you want to call it. I mean, what it is actually like a very controlled burn, okay? So because you're destroying the top layers of the skin, that is what is going to stimulate the remodelation of the tissue. Therefore, after that, you're going to have almost, new skin. What happens is that the person gets painted with this, with this substance, and then you wait a certain amount of time until certain markers tells you that the solution has reached, the depth that you wanted. Once that is done, then you apply what is called a neutralizer, or you simply wash off the product. And then after that, obviously, you give some post-treatment care instructions and products.
What can I expect after treatment?
For a medium depth peel, what you're going to get is certainly a certain degree of redness and swelling to the skin. I mean, that usually is the most likely. For that, obviously, you're going to be given certain products that they will help heal and they will help cope with this kind of inflammation. If it's something like a TCA, obviously this kind of inflammation is going to be much more. So it might look like, well, you need to take some time off. After a very deep peel, which obviously you're going to see much better benefits. Usually you need to take about maybe 10 days off.
What symptoms do I go through?
I mean, if you ever seen a burn, I mean, it's very, very similar. It's actually a superficial burn. So what you're seeing is redness, you're seeing swelling. Another thing that you're seeing as the time goes by, if there was certain pigmentation, the pigmentation will become probably much darker because it's the top layers of the skin sort of, separating from the rest. You might see, yes, like the skin is peeling a little bit. Sometimes there is exudation, which means like a little bit of oozing of fluid from the skin, which you have to obviously nurse and you have to clean up and so on. You have to stay away from the sunshine religiously and allow the tissue to heal, So, I mean, that's usually what you can expect.
How long does it take to recover?
I'd say the recovery time has to be about 1 week, 10 days, sometimes a little bit more.
Is it painful?
Obviously, if it's done under anesthesia, it is not necessarily a painful treatment. If it was without anesthesia, I spoke to patients that they had it without. They said, well, it was rather unpleasant. So the next time, certainly I would prefer to be sedated.
What post-treatment procedures should I follow?
It is very, very important to stay away from the sunshine, and any clinic after a peel like this will give you a protocol of creams to use, including sunscreen that has to be a high factor like 30. Provided it is applied regularly, that is what is important. And then other products that they help on the healing or the remodelation of the tissue.
Can I spend time in the sun after treatment?
I think that provided that if it has been a few months since you had the peel, the only thing that the doctor would recommend you is that remember that now you're having tissue that is rather fresh, and probably doesn't have much pigmentation, because the pigmentation is something that happens, when you're exposed to the sunshine. So it is important to preserve what you have created new. So the ideal is that you use sunscreen.
Who can carry out chemical peels?
The light peels, the ones that they are on low concentration, the usual is that it can be performed by a beauty therapist very safely. And then when you go to medium and deep peels, that the usual is that a physician performs it. Yes.
How much do chemical peels usually cost?
Usually it's about maybe about £700 for a TCA. That will be quite accurate.
What is TCA?
TCA stands for trichloroacetic acid, which is one very much researched and very much used compound, or acid that is used for chemical peels.
www.busybox.com